You're listening to this because you have anxiety and want help. You may have already sought out help, or you may be uncertain what kind of help to seek. But you want to learn how to manage your anxiety. So we will talk a little more about what cognitive behavioral therapy is and what you can do. Hello again, and welcome back to Quieting Anxiety. I'm Dr. Monica Frank, and today I want to talk about something really important: getting help for anxiety, and why CBT, cognitive behavioral therapy, is such an effective approach. Before we get to that, let's focus on a progressive muscle relaxation exercise for the facial muscles. Breathe gently and start by tightening the muscles in your forehead. Wrinkle your forehead as tightly as you can. Feel the tension building across your brow. Hold that tension for a moment, and now release. Let your forehead smooth out completely. Imagine the tension melting away, leaving your forehead soft and relaxed. Next, squeeze your eyes tightly shut. Feel the muscles around your eyes contract. Hold that tension, and now release. Allow your eyes to relax completely, softening the area around them. Allow yourself to feel the soothing sensations around your forehead and eyes. Continue with your gentle breathing as we talk. Now let's talk about CBT and getting help for your anxiety. If you're someone who's been trying to manage anxiety on your own, I completely understand. Anxiety can be tough to deal with, and figuring out the best way to manage it isn't always straightforward. While I hope you'll find my CBT methods helpful, sometimes working with a therapist is the best way to get the guidance you need. Therapists can provide additional support, especially for more advanced techniques like exposure therapy, which can feel overwhelming without the right guidance. Having someone walk you through those steps can make a big difference. And let's talk a moment about the role of medication. I know that when anxiety becomes overwhelming, a lot of people turn to their doctor first. And too often, that leads immediately to a prescription for medication. Medication can be helpful in some situations, but it's important to know that it's not a cure-all. For some people, medication provides enough relief to make it easier to focus on CBT techniques, and that can be helpful. But relying solely on medication without developing coping skills may not provide lasting change. Some anti-anxiety medications can even create dependency. And antidepressants, while commonly prescribed, also have their limits. It is especially concerning for people who have been on medications for anxiety and depression most of their lives. And as they age, these medications may contribute to health conditions or interact with other necessary medications. So if you're using medications, think of it as a support tool rather than the solution itself. You might be wondering why you should consider CBT as your go-to treatment. Well, after working with clients for over 30 years, I can confidently say that CBT is one of the most effective approaches for managing anxiety. If you're not familiar with CBT, think of it as a massive library of tools that have been researched extensively for more than half a century. These resources help people change thinking and behavior that contribute to common problems, such as anxiety. What makes it so effective? There are a few key things that I've found really make a difference. First, CBT consists of common methods we all use to cope with life. People with anxiety often believe that others are just naturally calm or rational thinkers, but that's not really true. Most people who manage stress and anxiety well are typically using CBT strategies without even realizing it. If you listen closely to people, you will begin to recognize how they apply these methods in their lives. For instance, I frequently hear people outside of my office say, when describing a difficult event, "But then I told myself." In other words, they were using self-talk to cope with a situation. I've also heard people say things such as, "Then I took a deep breath and," describing how they calm themselves before tackling a problem. They may have learned these skills naturally or been taught by parents or teachers at an early age. If these skills weren't part of your upbringing or a natural part of your repertoire, that's okay. You're simply learning them now, and that's a great step forward. The second aspect of CBT that makes it effective is CBT is skills training. This point is frequently glossed over, sometimes even by professionals, which is why I think some people who have tried CBT come away believing that it doesn't work. For instance, once when I was lecturing a group of psychiatric residents, future psychiatrists, about using CBT with sexually traumatized clients, one of the doctors stated, "I tried that cognitive therapy with my patients and it doesn't work at all." As I explored with her the specifics of what she had tried with her patients, I found that basically she had told them how they should think and then expected them to change their thinking. When I asked her what methods she used to help them practice and repeat the new ways of thinking in daily life, she was speechless. I then explained that the key to successful cognitive therapy was repetition of the statements that challenge the thinking, and that the therapist must use methods to help clients do that. People don't change their thinking just because they are told to think differently. If that was the case, most people wouldn't need CBT because someone else has probably already told them how they should think. The difference with CBT is that a variety of methods have been developed to provide the steps to help change thinking. Changing the way you think is like learning any new skill. It takes practice. I remember when I was learning Kempo karate, my instructor said, "When you've practiced this move thousands of times, it'll become automatic." The same idea applies to CBT. You've probably spent years, without even realizing it, reinforcing unhelpful thought patterns. How many times have you said negative things to yourself like, "I can't stand this. I'm so weak. I'll never be able to have a normal life"? These patterns prevent you from taking the steps towards change. Well, it's time to begin to counteract those learned patterns of thinking. To create new, healthier patterns, you'll need to practice often and consistently. Whether it's reading CBT materials, listening to audios, or writing down helpful thoughts, repetition is what makes those patterns stick. I've even created audios that help you change thinking by just listening to them. We will talk more about them later. CBT for anxiety is about learning how to develop these new patterns of thinking and how to reduce the physical symptoms of anxiety. There are two major components to CBT for anxiety. One is cognitive therapy, which is changing the thinking patterns that increase anxiety, and the other is behavioral therapy, which is engaging in activities to help you cope with anxiety. Sometimes people confuse cognitive therapy with positive thinking. I have frequently heard the remark when I've talked to people about CBT, "I've tried that positive thinking, it doesn't work." However, CBT is not about positive thinking at all. In fact, positive thinking can be just as irrational and problematic as negative thinking. CBT isn't about telling yourself everything's fine. It's about challenging unhelpful thoughts and shifting your focus to something more realistic and balanced. Like asking yourself, what steps can I take to improve this? It's a practical problem-solving approach, not just blind positivity. For example, if someone believes everything will be okay, I don't need to worry, when a catastrophe is occurring, they may not take the necessary steps to control the situation, which allows it to become worse. There are times when we need to be concerned so that we can take appropriate action. However, cognitive therapy approaches this in a realistic manner. If we are worrying about something that is not likely to occur, then we are making ourselves feel bad about something for little reason. So CBT is practical and realistic. It's about assessing our thinking so that we can take the most reasonable approach. Think of it this way. How many hours have you spent in your lifetime repeating the detrimental self-talk? You likely have become very automatic in that way of thinking, so now you need to retrain your brain to think in a different way. To do that, you need to identify specific thoughts that are beneficial and to deliberately think those thoughts repeatedly. So the bottom line is that CBT has been demonstrated through decades of research to be an effective method for learning to manage anxiety. And as I said before, it will take effort, but if you take the necessary steps and follow these instructions, most people will start to notice some changes even within a couple months. So for today, your question to reflect upon is, are you willing to devote the time to learning CBT and how to manage your anxiety? Another question to consider is, do you need to seek guidance to help you with this process? And your task for now is to continue practicing the previous exercises and to reward yourself frequently for your efforts. Now let's continue with a little more facial muscle relaxation before we end. Breathe gently and try to get in touch with the relaxation you felt earlier in your forehead and eyes. Now we'll focus on your cheeks and jaw. Clench your jaw tightly, really squeeze those muscles, and now release. Let your jaw hang loose and your mouth soften. You may even part your lips slightly to feel the muscles fully relax. Now bring your attention to your mouth. Press your lips tightly together. Hold that tension. And now release. Let your lips soften. Your tongue rest easily in your mouth. Feel your entire face relaxing. As you continue your gentle breathing, think about how you are determined to learn about managing your anxiety. Give yourself credit for continuing to pursue this course. By consistently showing up and putting in the effort, you increase your chances of making meaningful progress. Until next time, keep practicing, keep breathing, and keep moving forward.